Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thanks so much for listening. You can certainly find us on iTunes or anywhere else. If you enjoyed the podcast today, definitely leave a rating and review. We're greatly appreciative of that. So the drug of the day today that I wanted to talk about was caffeine. Caffeine you may not consider a drug. You may consider more of a supplement. But regardless of how you feel, it has physiological effects on the body. It has potential for adverse effects as we escalate doses, and we've got the potential for drug interactions as well. So I think it's very important to recognize this given the vast amount of use of caffeine that our society uses out there. So most often, where I see caffeine used is obviously in beverages, things of that nature. However, there are multiple different tablets, formulations that are available over the counter as well. Often they're referred to as energy boosting or increased alertness or staying awake. Brand name is No Dose, for example. So understanding that, knowing that, we know caffeine is a stimulant, and that's what it's going to do. As we escalate doses, we're likely to get more and more stimulant effects, but that comes at a risk of complications as well. So let's get back, kind of round this into shape. Some brand names I've seen: Stay Awake, No Dose I mentioned. It's also in Excedrin in management of headaches, often obviously in combination with other drugs such as NSAIDs and aspirin or acetaminophen, but can be utilized in that situation as well. Mechanistically, caffeine is a phosphodiesterase inhibitor, which can increase cyclic AMP. It has CNS stimulant type activity. So increase in alertness, potential ramping up of heart rate, potential complications of insomnia, increasing anxiety, maybe even tremor, for example. But again, it's a dose-dependent effect. As we escalate doses, the risk for more and more complications certainly can add up. So I definitely think about caffeine when I'm working with patients. I absolutely do. And particularly if I see some of the potential complications from caffeine. So example, GI upset can happen with caffeine. The more caffeine you take, the more it has the potential to cause stomach upset, nausea, things like that. So if I see a patient on, high-dose PPIs, for example, and I know they're taking a lot of caffeine, that's definitely a patient where I'd say, hey, can we curb that caffeine use a little bit? Same thing with elevated blood pressure, increased heart rate. Understanding and knowing that somebody is using a lot of caffeine, we can likely pin a proportion of that adverse effect on some of that caffeine use. Same thing with sleeping at night. This is something I see in geriatrics so often, where patients start taking a sleep medication because they can't sleep at night. Well, maybe they're loading up on caffeine at 6, 7, 8 o'clock at night, and they're not understanding why they're up all night. Sometimes patients don't recognize that. It may seem obvious to us healthcare professionals, but patients don't recognize that sometimes. With caffeine, there definitely is a risk for dependence and withdrawal symptoms. I remember a headache specialist talking about the challenges of caffeine withdrawal because many patients can feel awful for up to a week or two if they're trying to quit or cut back on their caffeine intake. So very, very important to recognize that, and along with that, the risk of medication overuse headache, and caffeine being a potential player in that risk there. All right, so one other thing I wanted to mention with adverse effects. So we talked about GI upset, tachycardia, insomnia, worsening anxiety, GI upset, maybe even diarrhea. Tremor is something that I have rarely seen. Usually that's going to be at higher doses and or in combination with other meds that could worsen tremor. But it is something to think about. So one case I remember, high caffeine intake, as well as other meds that could contribute to tremor, and the provider started primidone to manage the patient's tremor when it was because of adverse effects from high caffeine intake as well as other medications, the other stimulants the patient was on. So definitely think about that. And if you're seeing unique symptoms, you got to think there is a potential for adverse effects, and caffeine certainly in higher doses could contribute to some of those issues. There are some warnings, precautions with certain disease states, seizures, diabetes, GI bleed, GERD issues, anxiety, insomnia I mentioned, cardiovascular disease. These are all situations where caffeine could potentially worsen those conditions. Now, how often does it happen? And how severe is it? I would say for most patients that are doing a cup or two of coffee a day, it's probably not going to be high on your radar as a big issue. Now, you get that patient that's a frequent user and they're doing coffee and energy shots and all sorts of other stuff throughout the day. Yeah, it definitely could pose a much greater risk. So those are just kind of the way I think about things, and the quantity, the amount of caffeine definitely is a critical thing to think about. Monitoring with caffeine, I would say blood pressure, pulse, those are two things that I take a peek at. As far as specific lab work, you're probably not going to do much for routine lab monitoring with caffeine, as long as you don't see any clinical indication to do so there. All right, so let's take a quick break, and then we will wrap up with drug interactions. If you're a pharmacist or pharmacy student, definitely go check out meded101.com/store. We've got NAPLEX resources, BCPS exam resources, BCACP, so ambulatory care, medication therapy management certification exam, and geriatric certification exam. Definitely go check out those resources, support the sponsor, support this podcast, Real Life Pharmacology. In doing so, also, if you're in the market for just clinical reading, clinical education on medication management, case studies, and common things you're going to see in clinical practice, we've also got links at meded101.com/store for Amazon books, Audible books, and other resources as well. So go check those out, support the sponsor, and help us grow this podcast. All right, so let's finish up on drug interactions. First thing I wanted to mention with caffeine is CYP1A2. That is an enzyme that it can affect and can be affected by. So a good example here is fluvoxamine. It's a drug that's not used incredibly often. It's an SSRI. It can inhibit CYP1A2, which may lead to an increase in concentrations of caffeine. So if you see a drug, maybe a new drug comes out, and you know it's got 1A2 inhibitory activity, it could potentially raise the concentrations of caffeine. Also, caffeine may have some inhibitory activity itself on CYP1A2. A good example of a drug that's broken down by CYP1A2 is clozapine. So we may see increased concentrations of clozapine on account of caffeine being added to a patient's medication regimen. So definitely think about this, and obviously caffeine's availability as an over-the-counter agent and in various products from chocolate to coffee and things of that nature, can cause some issues potentially with medications. Again, the more caffeine you take, the more likely it is you're probably going to run into issues. Caffeine can also alter lithium levels, potentially lowering lithium levels, so that's an important thing to think about. And then from the adverse effect profile, I definitely think about cardiovascular concerns. So if you've got a beta agonist on board, that could certainly increase the risk for tachycardia, for example. Stimulants like methylphenidate, amphetamine salts, even illicit drugs, methamphetamine, cocaine, having caffeine on board, or significant amount of caffeine on board, in addition to taking some of these stimulant agents, may really exacerbate that tachycardia, exacerbate that hypertension. So definitely important to think about that. Opposing effects, this is something I have seen in clinical practice, probably most often with insomnia medications. I've seen it numerous times where patients take caffeine late in the day and then they take a sleeping pill at night. So very, very important to assess for that, because we don't want to add additional sleeper medications if we don't have to. So ensuring that patients are taking caffeine early enough in the day where its effects are going to wear off in time for bedtime is important to try to limit the use of some of those sleep medications. All right, so that's going to wrap up the podcast for today. If you enjoyed this episode or any of the episodes previously, do us a kind favor. Leave us a rating, review on iTunes or wherever you're listening. Share us with a friend. Send an email, message, text, social media share, whatever, to help us grow the podcast and share good, solid medication information and education to healthcare professionals. Go sign up at reallifepharmacology.com. Check out our mailing list. You'll get a free 31-page PDF on the top 200 drugs. Great little resource just to refresh yourself with commonly used agents in practice and some of the most consequential clinical pearls that go along with those medications. If you want to track me down, I have occasionally taken on side projects and work and helping people. So LinkedIn, you can find me, Eric Christensen, PharmD, BCPS, BCGP. And of course, you can find me at reallifepharmacology.com or meded101.com and hit the contact button there. I'm going to sign off for today. I thank you so much for listening. Hope you picked up a few practice pearls. And we will see you another day. Take care.
Hello, it is Ryan, and I was on a flight the other day playing one of my favorite social spin slot games on ChumbaCasino.com. I looked over at the person sitting next to me, and you know what they were doing? They were also playing Chumba Casino. Coincidence? I think not. Everybody's loving having fun with it. Chumba Casino is home to hundreds of casino-style games that you can play for free anytime, anywhere, even at 30,000 feet. So sign up now at ChumbaCasino.com to claim your free welcome bonus. That's ChumbaCasino.com and live the Chumba life.
No purchase necessary. VGW. Void where prohibited by law. See terms and conditions. 18+.